Now, the Gambia is keeping a close eye on the dangers posed by the Indian variant of COVID-19, following the confirmation of at least 2 positive on travelers from India. The Deputy Director of Health Promotion and Education at the Ministry of Health flagged the Indian variant as more dangerous than the UK variant of the virus. DCC has more of that in this report.
COVID-19 has forced many countries, including the Gambia, to take stringent measures to contain the spread of the virus, giving birth to various degrees of economic backlash. With the outbreak of the Indian new variant in the Gambia, health authorities are so much awake to halt or better still, roll back further incidents. Deputy Director of Health Promotion and Education, Sanjali Trawale, exposed the nature of COVID-19 in the form of this variant.
One can harbor the virus without knowing it for a long time. So it's not easily detectable. And you may be carrying the virus without any sign or symptom. So this is the most difficult part of it. It's unlike the other one. When we are infected, you can quickly go into some problems, like by seeing the sign or symptom. But for this one, you can move with it. So that's why it's very, very dangerous. You can be infecting others. It can be widespread. It can be transmitting without even knowing that you even have the virus. So since this one was detected sometime in April, one of the measures we are doing is like anybody coming from that hotspot, not only from India, but any other hotspot, we will put you on quarantine. That's exactly what we are doing. We put every person, every traveler coming from any hotspot on quarantine. Now, what we are also doing is we are following the contacts. This person, when he came, he was at home, and he was actually living with family members. And you may know that some of those family members must have interacted with others. So what we are doing is we are trying to track those very people they had interacted.
The registration of the Indian variant in addition to the UK variant in the Gambia, according to Mr. Trawale, calls for more vigilance among the population and harder work on the health sector.
I think people should take this thing very seriously, because we were battling with the original virus last year, and now we have these new strains. So this should be worrying. Having new strain should be worrying. So that's the reason why we are saying people should take up precautionary measures that we have been advocating, that we've been saying, that we've been advising people to do. These are the use of face mask, hand washing, and recently vaccination.
The United Nations issued a press release 2 days ago calling on the Health Ministry to take urgent action against the new variant by tracing and isolating those exposed to the variant. According to the latest situational report by the Ministry of Health, the Gambia has recorded 5,993 confirmed cases, out of which 5,780 have recovered. 179 deaths were also recorded across the country. Reporting for iAfrica News, I am DCC.